Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
syndrome. Here this occurs because of increased vascular endothelial growth factor.
Ovarian hyperstimulatory syndrome. Pathophysiology of ovarian hyperstimulatory syndrome. In ovarian hyperstimulatory syndrome, the main important thing is there is increased vascular endothelial growth factor. Actually, when we give HCG injection, it will rupture the follicles. On rupturing of the follicles, it releases the follicular fluid which is containing inflammatory mediators. One of the inflammatory mediator is vascular endothelial growth factor. So here there is increased vascular endothelial growth factor is the first pathogenetic step.
Which makes the blood capillaries leaky. Because of this, the solid component remains inside, whereas the liquid component comes out. Because the liquid component comes out, this liquid component, that is, there is accumulation of fluid, is seen in the third space, resulting in ascites, hydrothorax, pleural effusion, and pericardial effusion. Because the solid component remains inside, there is increased hematocrit causing hemoconcentration, which increases the chances of thrombosis, resulting in disseminated intravascular coagulation. Increased estrogen stimulates the renin-angiotensin system, thus resulting in electrolyte imbalances. Because of excessive pathophysiology of ovarian hyperstimulatory syndrome. In ovarian hyperstimulatory syndrome, there is excessive follicular stimulating hormone. Because of excessive follicular stimulating hormone, ovaries are filled with huge follicles. Thus there will be large and tense ovaries, which cause life threatening conditions. This will result in increased chances of torsion of ovary, and there is increased chances of rupture of ovary, and there is also increased chances of hemorrhage of ovary. Controlled stimulation of ovary is the aim while using assisted reproductive technologies.
thank you and thank you for watching.